today I'm going to perform lavage on my patient. So the purpose for this is to irrigate the stomach, his stomach that he's feeling, and so before that I'm going to prepare all my equipments and do my hand washing. So assuming I did my hand washing, I'm going to don my gloves, but before doing that I'm going to confirm my patient. And according to his chart, his name is Japet D. De La Peña, and I need confirmation for that. So you need a name tag. So as you can see, his name is Japet. And so before performing this, we need to, like I said, do hand washing and prepare all my equipment. So assuming that I did my hand washing, and now I'm going to don my gloves. So first we're going to check his stomach for any acidity, sir. So you can hear it. So I'm just going to open my irrigation bag, and then make sure, and assuming this is a 60 cc syringe, and make sure that the needle is removed. And now we're going to open the port here, and then slowly fill with air. And then while doing it, make sure you use your stethoscope to hear any gurgling. Assuming that we did. And now we're just going to, assuming that this is my saline water, I'm just going to put this here on my bottle, so we're assuming, and then we're going to aspirate the stomach here. And we're going to let it all out. So once it's all out, we're going to put the irrigation, the saline for irrigation. We're going to do this a couple of times until everything is clear. And once we do that, we'll do this a couple of times. And after so assuming we did it until everything is done. So assuming we're going to remove the syringe, and then we're going to close the clamp on the tube, and then we're going to place the patient on a comfortable position, and ask if you feel any discomfort. So sir, you feel fine?
Yes, I feel fine.
Okay, sir. So after doing all that, make sure to clean everything and position the patient in a comfortable position, provide privacy, and document all your findings. My name is Sean Isorano. I am a student nurse from DMC College. And today I'm going to perform Gavage to you. But before that, please know your name, address, and birth, sir.
I'm Gavage and Lavage, looking for regular schools.
Okay, sir, by CPC and name tag for confirmation. Okay, Mr. De La Peña. Today I'm going to perform gavage to you, since the purpose for this is to help patients who are unable to eat anything now. So you need a support like tube for you to gain the nutrients for your body. Is that okay, sir? Okay. So before I'll perform, I'm going to gather all my equipments. So assuming I've done my hand washing and I've gathered all my equipments, so sir, I'm going to perform gavage to you. Is that okay, sir?
Okay.
First, after performing hand washing, so assuming I've done my hand washing, first put on the gloves. So after putting on the gloves, what you need to do next is to measure the nostril and the head, and down to the middle part. And this should be where our stomach, where our tube is heading to, for the stomach. So assuming that we did that, now we're just going to quickly open our lubricant bottle here. Again, so we'll put it here. So we need to lubricate 2 or 3 centimeters of the tube. So after lubricating it, we're going to insert it to the patient's nostril. So sir, please stay calm. So assuming that I'm inserting it to the patient's nostril, so you might feel a sensation here, but please don't overreact. And if the patient is having difficulty of breathing and coughing, we need to stop reinserting it and pull out immediately. So sir, do you have any difficulty, sir?
No, I'm good.
Okay, sir. So assuming that the tube is safely inserted, for us to check if it's actually inserted into the stomach, we need to aspirate. So some tubes don't have clamps, but modern tubes now do. So assuming that we have our clamp here, we need to open it, and then we need to aspirate, and then the way you know that the tube is in the stomach, you can see contents of greenish and brownish liquids. So assuming here, okay, looks like we're in the right spot. We have brownish, greenish colors, and that means it's in the stomach. So dispose of the syringe, and after that, close the clamp. Make sure, and after inserting it, we need to secure the tube on the nostril. So we're going to need some tape, surgical tape for that, and we're just going to, assuming I'm taping it on the patient's nostril. Sir. Okay, the tube is now secured, and after doing that, sir, do you make sure the patient is comfortable if the patient is conscious. So, sir, do you feel fine? You need.
Yeah, I'm okay.
Okay, sir. So, after inserting this tube will help you gain the nutrients you need, sir, since you are unable to eat now. So, with the assistance of this tube, you're just going to feed it to your nostril down to your stomach. Okay, sir. So after doing the procedure, make sure to clean everything, provide patient with privacy, and put the patient in a comfortable and safe position and document everything. Okay, sir. Thank you for the report from Gavage to you.
Thank you.